I'm here to perform a head to toe assessment, which will take about 30 minutes of your time. Is that okay?
Yes.
Okay, so I'm checking my doctor's orders and checking for safety, provide privacy for the patient, and then I perform hand hygiene, and then I come back to you. Can you verify your name for me and your date of birth?
Ora Ogbe, 28 June 1992.
Okay. Do you have any form of allergies?
No.
Are you currently on any form of medications?
No.
Okay. Can you tell me what brings you here today?
I came in for a health assessment.
Okay. So your vital signs, I'm going to defer your vital signs, your height, your weight, your BMI, your temperature, your O2 sats. I'm going to defer. So, do you have any cultural or spiritual consideration that I should take into play?
No.
Okay. Have you had any form of surgeries in the past?
No.
Okay. Your immunizations, are they up to date?
Yes.
Okay. Patient, can you tell me where we are?
Currently at the hospital.
Okay. Do you know what date it is?
Yes, 24th November 2024.
Okay. Do you know who the president is?
Yes.
Who is the president?
Joe Biden.
Okay. Patient is alert and oriented to place, time, and situation. Patient appears not distressed, appears appropriately dressed for the weather. Patient's speech is fluent, articulate, and understandable. I do not see any form of tics, tremors, or delay. Because the patient is alert and oriented, I'm going to defer the mini Glasgow scale. So I would like you to grip my fingers and squeeze. Squeeze. Okay. Grips is equal bilaterally. Can you flex your foot up, down? Okay. So plantar reflex is 4 plus. So I will go ahead and check for your muscular skeletal. Please, can you stand for me and walk this way and down and back? As the patient is walking, the walk is smooth. I do not see any staggering. Can you bend for me? Can you bend and touch your toes? Okay, so I'm going to palpate your back. Palpating the spine, I see no curvature noted, no scoliosis, no lordosis or kyphosis noted. Please stand. Can you swing your arms for me this way, in and out? Okay, arm swing is symmetric, equal bilaterally. Can you lift one foot and move this way? Okay, balance is good. Can you see it? Okay, so I'm going to check for your muscle tone and strength. Can you put your hands this way? Can you resist my hands? Resist my hands. Resist my hands. Resist my hands. Okay. Muscle and strength in the upper extremities is 4 plus. Can you resist? Bring down your leg. Can you push towards me? Okay. Muscle tone in the lower extremities is 2 plus. So I'll go ahead and check for your reflex. And yeah, use it like that. Okay, reflex in the tricep is 2 plus. reset reflex in the triceps is 2 plus. And then can you release your full leg? And I do this. Reflex in the lower extremities, the plantar reflex is 2 plus. Can you shrug your shoulders for me? Spinal accessory, cranial nerve 11 is intact. Okay, now, sorry, can you put your head towards me? Resist my hands. Resist my hands. Okay. Now I'm going to the hints, the head. Do you have any form of headaches, seizures?
No.
Any form of trauma, concussion?
No.
Okay, looking at the head, I see that it's round and metamorphosalic. I see no abnormalities. On the face, I see the eyebrows are symmetric, both eyes are symmetric, the eyelash is symmetric. I'm going to go ahead and palpate your head. Do you feel any pain?
No.
Okay. The hair is evenly distributed. I see no alopecia, no bumps, no lumps noted. And then moving to the ears. Do you have any problems with your ears?
No.
Okay. We're going to do the whisper test. I'm going to stand behind you. Can you close one ear? Can you close your ear and tell me what I whisper? Pink. Say it now.
Pink.
Whisper test is acoustic nerve is intact. Cranial nerve 8. I'm going to check. I'm going to check your ears. I see no drainage. I see that the pinna and the auricle it's looking normal. Palpating the ear, I see no swells, no bumps. The pinna is firm but not stiff. So looking into your ear using the otoscope, I see no cerumen buildup. I see the tympanic membrane is fairly gray. The cone light is visible. I see no drainage. Moving to your eyes. Okay, so when last did you get your eyes checked?
2 weeks ago.
Okay, because the patient just had the eyes checked, the learning charts is deferred. Can you look down this way? So the eye constricted from there's accommodation in the eye. Can you follow my pen light? The 6 cardinal points of gaze is intact. Cranial nerve 2, 4 and 6 is intact. I see no nystagmus, I see no lead lag, I see no ptosis. Can you look straight ahead for me? Okay. Look straight ahead. Okay, so the eyes constricted from 4 centimeters to 3 centimeters. Do you wear contacts or glasses?
No.
Okay. Moving on to your nose. The nose is at midline. I see no swells. I see no drainage. Do you have any problems with your nose?
No.
Do you have any form of congestion?
No.
Okay. Can you hold one side of your nose and breathe in and out? other one. Okay. So there is patency in the nose. I see no obstruction, occlusion. Okay, can I look into your nose? Can you tilt your head? So the hair in the nose is evenly distributed. The, the nose is pink and moist. The mucal mucosa is pink and moist. Repeat the word. And the nasal it's at midline. Okay, can you close your eyes and tell me what you smell? Just go ahead and say.
Why not?
Okay, so the cranial nerve one is intact, the olfactory. Okay, moving on to the lips. I see no cracks. I see no bruises. The lips is pink and moist. Can you do you have any problems with your mouth?
No.
When last did you see the dentist?
A year ago.
Okay, so it is recommended that you see the dentist twice a year, and it's recommended you brush your teeth twice a day, morning and night, and after every meal you use the floss just to be healthy. Okay, can I look into your mouth? Can you say ah? Okay, the soft palate and the hard palate, it's good. I see no bruises. I see no cracks. The uvula is at midline. Please, can you stick your tongue out and move side to side? Okay. Cranial nerve 12 is intact. Can you swallow for me? Okay. Cranial nerve 9 is intact. The gag reflex, I'm going to defer. Yeah, no. Okay, the neck. So looking at the neck, I see no swells. Do you have any problems with your neck?
No.
Okay, can you bend your neck and touch your chin on your chest? Okay. Okay. So going to palpate your thyroid, the glands around your head. We have the preauricular, postauricular, submental, submandible, anterior cervical, posterior cervical, supraclavicular. Do you feel any pain?
No.
Okay, and then I'm going to go ahead and palpate your sinuses. We have the frontal sinus, the ethmoid, the maxillary sinus. Do you feel any pain?
No.
Okay, all right, so moving on to the skin. Um, how often do you take a bath or a shower?
Daily.
Okay. Do you use the sunscreen whenever you're exposed to the sun?
Yes.
Okay. So looking at the skin, I see no bruises, I see no tattoos, I see no lesions, I see no moles. The skin feels smooth, the temperature is warm, and the skin is dry and moist. I feel no edema noted. I'm checking for skin turgor. The skin turgor is good. The capillary refills returns in 3 seconds. I'll check your capillary refills here too. Returns in 3 seconds. The axilla, I'm going to defer. Can you do your fingers this way? Okay, so I'm checking for clubbing. I see no clubbing noted. Now we move on to the respiratory. So do you have any problems breathing?
No.
Do you have any shortness of breath?
No.
Any asthma?
No.
Okay. Are you? Do you smoke?
No.
Are you exposed to any form of secondhand smoking?
No.
Okay. So looking at the patient, I see no distress in the breathing pattern. The chest looks normal. I see no barrel chest. Um, so I'm going to listen to your heart sounds. Okay, so starting from the apex, breathe in and out. Okay, so bronchial sounds were heard on the trachea. Bronchial vesicular was heard, and the vesicular sounds was heard. I'm going to auscultate the posterior. Okay, can you breathe in and out? Okay, so resonance sounds was heard on all lobes. I'm going to go ahead and percuss. Stay on, please. Resonance sound was heard on all lobes. And then I'm going to go ahead and the cardiac. Do you have any heart problems?
No.
Do you have any history of heart failure in your family?
No.
Okay, so I'm going to listen to your heart valves. The aortic valve, which is at the second right intercostal space. The pulmonic valve, the Eps point, the tricuspid, and the mitral. So the aortic valve is at the right second intercostal. The pulmonic is at the second left intercostal. The tricuspid is at the third left intercostal. No, the Eps point is at the third left intercostal. The tricuspid is at the fourth left intercostal, and the fifth is the mitral at the left intercostal lobe. And um, okay, the GU. Um, have you had any form of breast examination?
No.
Do you have any form of cervical cancer or ovarian cancer in your family?
No.
Okay, the reproductive, I'm going to differ. Um, when last did you use the bathroom?
Today.
Okay, do you have any obstruction, any form of diarrhea, constipation?
No.
Okay, so now I'm going to check your abdomen. So I think you just be sitting. So do you like you're lying down? I see that the abdomen is flat. Do you have any stomach pain, any abdominal pain?
No.
Okay, so I'll start and auscultate from the lower Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. So tympanic sounds, vowel sounds was heard on all the 4 lobes. So I'm going to go ahead and auscultate. I'm going to percuss. So tympanic sound was heard in all the 4 lobes. I'm going to go ahead and palpate, the light palpation. Do you feel any pain?
No.
Okay, so the deep palpation. Let's start like this now. Do you feel any pain?
No.
Okay, so I feel no masses, no swells, and patient denies any form of pain. The bladder. I'm going to palpate the bladder. I see no dentition, no swells, and can you stand again for me? Okay, so looking at the patient and assessing the patient's legs, I see no varicose veins, I see no abnormal vascularity. Sit please. So conclusion. What's your living condition like?
I live alone, no problems.
Okay. How old are you?
28.
Okay. Do you have a social life?
Yes.
Okay. What do you do in your spare time?
Play soccer, travel.
Okay. So I'm done. Thank you so much for your time. And then if I'm giving the patient his call light close to the bed, lowering the bed to the best lowest position, opening up the curtain. Do you have any questions for me?
Not this time.
Okay, perform hand hygiene. Thank you so much.
Thank you.